And I wasn't mentored for 5 cases, 10 cases. I was mentored for tens, maybe hundreds of cases.
Right, I believe now we're recording. So welcome back to the Dental Implant podcast with myself, Pav Ferhan. I am very honoured today to have a friend of mine coming on to discuss how he got into implant dentistry and his thoughts on career progression, and I'm going to chime in as well. I'd like to introduce you to Ferhan Ahmed, who is dual qualified, and I believe your practice is purely limited to implants. Is that correct?
That's right, Pav.
Yeah, and you do mentoring, teaching, and there's full arches, and I've seen the quality of your work. It's just inspiring. I love looking at it because it's like, okay, I know the type of work that I need to be gunning for now. So what I'm going to do is I'm going to let Ferhan just explain a little bit more about himself, and then we will jump in and start discussing kind of like how to get into implants, how to progress in your career. I want to touch a few bits on some of the mistakes a lot of novices get when they're first starting to implants. I know Ferhan wants to talk about mindset and mentoring and just building that confidence. So Ferhan, if you could please just introduce yourself a little bit more, that would be great.
Thank you very much, Pav. Thank you for your kind words. Best way to introduce myself is I'm an implant dentist, and I have a real passion for education and training. And it all started really when I was sort of 16, deciding on a career path. And I grew up, from a Pakistani background and doing well at school. You were sort of, the decision was there to be made. What do you go? And I didn't want to follow the typical, stereotypical path of doing medicine. So I did dentistry along with a number of friends from my class. So I did dentistry. It was good. I enjoyed it. I really did enjoy dentistry. But when I was doing some house jobs in dentistry and maxillofacial surgery, I was really inspired by the colleagues I worked with. And I also thought to myself, what next? I want more. And I went to then follow a path and did medicine, and I studied 4 years postgraduate program in Liverpool. And then subsequently, I did 2 years as a general sort of junior doctor in hospital. And that was great, and it was well. And in the back of my mind, I always had it. I'm doing medicine because I have a passion for learning, furthering myself, but I have the option to pursue a career in maxillofacial surgery if that's what I wanted. But, I got married and decision had to be made. What path do I want to follow? And I looked at it and I looked at the colleagues around me, and I just wanted more control to do what I want with my life and have autonomy. And just things fell into place, and I had an opportunity to buy a small referral practice, which I did as a junior doctor. I ran that at weekends, and during the week I would work as a junior doctor. And then as my 2-year program as a junior doctor finished, I had the option to join a partnership, a group of dental practices. And, I felt the stars aligned, and I took that leap. It all went well, and unfortunately the partnership didn't work out, and I went my own path. But naturally, looking back at my experience, I've always been very much a surgical dentist. And so through dental school, I was focused on surgery. Through medicine, I kept in touch with my dental foundation, working in practices, doing oral surgery and doing on-calls and max-facs. So I've been someone that's always been just done surgical dentistry and have very little sort of experience within general dentistry, so root treatments, orthodontics, cosmetic work. That's not me. I'm a surgical dentist. And then, so once I came out of a medical practice, it was natural for me to go into surgical dentistry. So I did a lot of oral surgery, and I utilized my skills as a doctor. I did a lot of sedation. So I was doing oral surgery clinics, doing sedation, and I was peripatetic doing sedation for a lot of clinicians. And then I developed a network of people, of clinicians, and I found what next. I wanted to do more with my skills and fine-tune skills. So it was a natural progression for me into implant dentistry. And that was back in sort of 2010, 2011. And I was fortunate because the group of dental practices I bought with my business partner, still my business partner, Abid. And he's very well experienced in implants, and he was the first person to really support me in my implant journey. So started with simple implants, but I watched him do a lot of full arch. And then it sort of progressed into simple implant dentistry more and more. And I felt that I put my oral surgery and the sedation sides sort of down the pecking order, focused more and more on implant dentistry, upskilled, pushed it on until about 4 years ago, I became implant only. And sort of in the last year, now I'm much more geared towards doing complex full arch work, grafting work exclusively. And it's just been a progression, and I've been fortunate. The people I've met along the way, the people that have inspired me, mentored me, have led me into this path. So I'm implant only, focusing on more complex work, so full arch and grafting, and fortunate that I'm now able to mentor a lot of colleagues and help them on a similar journey. So hopefully get them to do what I do, but faster, because I've gone through ups and downs and made mistakes. But I'm hoping that I'm able to get them where I am at the same level, if not beyond the level I'm at, without the mistakes that I've made. I'd like to think not too many mistakes, but if they can be avoided, great.
See, it's interesting because your career progression into implants is different, is actually quite very different from mine. Because I mean, I'm not dual qualified. I think from a professional level, not doing max fax is one of my biggest regrets. But I'm 42 now. I'm not going to go back and do medicine. But for me, when I first graduated, very quickly I went into general dentistry and purchased my own practice within about 3 years or so. One of the things that I found is I wasn't a good businessman, and I was making a lot of mistakes and losing a lot of money when I owned my practice. And because of that, I was constantly trying to add more skills in. So I was learning how to do big restorative cases. I was learning how to do ortho. I was learning how to do facial aesthetics. I was learning how to do surgical perio. And in fact, implants was very low on my list because I didn't enjoy surgical dentistry. And a big aspect of that is I didn't have the knowledge and confidence. And after a few years, it got to the point where I was just bored doing the other stuff, and I started with restoring implants and found out actually I quite liked it. Then I started learning about implants. Then I started placing about implants. And then all of a sudden for me, it was like, well, actually, you know what? This is a huge passion. I love this because implants takes into consideration everything else. You have to understand the surgical side. You have to understand the perio side. You have to understand the restorative side. You've got to understand the biological side as well. And then from that, I progressed into my MClin Dent, and I just continue to learn and do courses. Now, I am what you refer to as a risk taker. So my second solo case after I completed my implant course, and that was with Rich Brookshaw and Bob McClelland, it was a dual arch all on four. The second solo case that I was doing. So it's, you know, for me is there are, and because of that, I've landed myself into hot water more times than I would have liked to. So a little bit later, Ferhan, what I'd like to do is I'd like to discuss with you, is you've already touched on this, and I agree with you as well. The mentoring aspect is so underrated, and it is really something that needs a lot more stressing, and it needs a lot more structure to it as well.
Yeah, I agree. And I wouldn't be where I am if I didn't have the support and mentoring of the people that I met along my journey. And there's still a number of them are still a part of who I am and help me to this day. And you never lose that connection. And so from day one, my business partner Abid helped me, and I worked with him for years. So the 1 day a week that he was in the clinic doing implants in our clinic, I'd be there by his side. And that happened for years. And I'd work on my own as well. But that day that he was there, I was there right by his side. And so that initial state, it was years I was mentored. I'd work on my own, but always go back. Yeah. And then I would sort of bit more experience, sort of 5 years into doing implants, I was fortunate to meet another colleague, George, who I worked really closely with. Again, I was by his side for years, and fortunate that he taught me so much. And I wouldn't be here without these people and others that have influenced the clinician I am today. And I wasn't mentored for 5 cases, 10 cases. I was mentored for tens, maybe hundreds of cases.
Yes.
And even to this day, I was speaking to a colleague recently and I said, you know what, in a year's time, I'd love to get someone I really look up to and pay them and come and watch me doing a full arch or doing a more complex full arch case and critique me, because it's on this quest of just perfecting our technique, getting better all the time. This is what we have to do. And we're never too good to be mentored. We're never too good to be critiqued. And we're never too good to have someone give their feedback on the work we're at. And that's really important to me. And when I teach and when I mentor other colleagues, I said, this is just the start. You're always going to have to be mentored. And on the program that I teach, sort of working on your mindset, working on the theoretical aspect of full arch implant treatment, then there's one-to-one mentoring. Then when you feel that you're able to treat some cases, not every case, but some cases are within your competency, we can move on to the next stage, step 5, which is virtual mentoring. And you never don't need a mentor. You always need someone to bounce ideas off. You can call them a mentor, you can call them a friend.
Yeah. One thing you touched on there, which really stands out to me, particularly listening to the words that you're using, is even now, somebody as experienced as yourself, you've got a very open mindset. You are open to critique. You are open to learning. That very much comes down to mindset. You know, for me, I enjoy learning. I enjoy critically appraising papers. I love reading textbooks. I love going on courses. I love sitting down and just chatting to mates about, you know, what do you think of this? What do you think of this? And for me, that is a mindset that I've developed over time. But it sounds like you've got a similar mindset as well. And could you expand on that in terms of if people are just getting into implants or they're early in their career and they want to progress, how do you think their mindset should be set so that they get the best out of their career?
So there's 2 different types of mindset. They talk about fixed mindset or a growth mindset. You need to be of a growth mindset. That everything you do is all about growth, development, being better every day, and progression. And when you encounter problems or challenges, that you twist the difficulty or the failure you face and you learn from it. You don't see it as someone knocked you down. You see it as an opportunity to get better. Someone identified some way of making things better. And so if I got you in to watch me doing work, Pav, I'd say, right, what did you think? How could I be better? And I'm always looking for opportunities to learn from other colleagues. And a lot of the time, I'm in visiting a clinic, working with a colleague as the supposed expert. But that's not the case. I walk in, and it's important that I come across humble. I'm there to learn equally, and I'm always looking to pick up tips. And I think that is critical for growth, for development, and for progression, that you as an individual always want to look for ways to improve where you're at and develop. And when you're hit with setbacks, you don't see them as a setback, but you see them as an opportunity to get better and grow. And I think that is critical, and not just within surgical dentistry, but in all aspects of dentistry. Otherwise, it can knock you for 6, and you lose confidence, and confidence is critical. And as you go up the chain of complexity of work, you need confidence. You need confidence. You need to portray and ooze confidence in front of the patient, not arrogance, confidence. So the patient has that trust in you. When you walk into the room, this is the person that's going to do my treatment. And you've got to gain that trust from the patient in minutes, that they feel comfortable, that you're doing your absolute best to look after them, and you will do whatever it takes to get them the outcome that they desire. And you have to gain their trust, and that comes down to confidence and how you portray that to the patient.
I agree with that entirely, and I think not only confidence in front of patients, but confidence when you're undertaking surgery as well. For example, when I'm working at Eva, my standard day is a dual arch. Now, that type of work is mentally and physically very draining. It's very, very draining. Now, what I need to do is if I'm undertaking treatment and I want to expose the mental nerve, I can't be like, oh, I think the mental nerve's here, I'll just have a little bit of a push. Or, if I'm doing a mucoplasty in the upper arch, it's, if I, because I've had it once or twice where I've hit the greater palatine artery, it bleeds like hell. It really bleeds a lot. Yeah. And you need the surgical confidence to be able to go, right, I know how to deal with this is what we do. The worst thing that we can do, and this again comes down to mentoring and understanding what to do in these cases, is to panic. And one thing, there was a great YouTube video where it was a neuroscientist who was saying that when we get stressed and anxious, we tend to hold our breath. When we hold our breath, our brain doesn't function properly. So you need that nice, even during surgery, I'm constantly focusing that nice rhythmic breathing in and out. And so, yeah, confidence in front of patients, because when you start doing a lot of implants, to us, it's just another day. We're just doing an implant on a upper six or whatever it is. But to a patient, it's a very big deal. And they need to feel that confidence coming from you. And I think another mistake a lot of dentists make when they're trying to get into implants is they think, right, I'm going to do this course, it's 1 day a week over 12 months. By the end of it, I'll be able to do 90% of cases. That's just not the case at all. The way that I liken it is kind of like once you graduate with your BDS, is that gives you a license to start learning. And doing that initial course in implants, it's a license to start learning in implantology. And it has to be a commitment. To what level, that's up to you. But it needs to be a commitment, otherwise you're going to be limited with regards to what you can do.
Yeah, I agree, Pat. And a couple of points that I want to take up that you mentioned is one, in terms of confidence, especially as the clinician coming in to mentor. If you're not coming across confident and assured in what you're doing, then how is that going to relay to the clinician that you're mentoring? So again, so important that you come across with confidence, you have confidence in what you're teaching. So the right people, you have the right people mentoring you that instill confidence in you as a mentee as well. And that's really, really important. And yeah, that's a point I wanted to make about sort of confidence as a mentor, confidence as a clinician with the patient, and confidence in doing more complex treatments.
For me, in terms of a mentor, that's actually quite a flexible term. Is if I find somebody on even on Facebook or Instagram where they're putting up good cases and I can look at them, for me that's still a mentor. A mentor can also be a mate that I work with who's got more experience than me. For example, I worked with Avik Dandapat for a while, and he used to say, "Pav, come and watch me do my surgery." He said, "I've been doing this a long time." He said, "Stand by me, watch how I do it, and I'll explain how I do it." You can also have formal mentoring arrangements as well. And I've had formal mentoring arrangements for people who are mentoring me, and I mentor others as well. But from your perspective, is if somebody wanted to get into implants or they wanted to progress, what should they look for in a mentor? What would you think? What would you say are the key factors that I should be asking? Right, I want to learn this. I'm looking for a mentor. How do I go about finding that mentor?
I think it comes down to a number of things. It's a two-way relationship, and both people need to win. So your mentor needs to be happy and the mentee needs to be happy about every single arrangement. You need to get on. You need to be able to sort of feel comfortable, and the mentor needs to be comfortable working with you, and you need to be comfortable with the mentor. What else to look for? I mean, what else are they doing for you? I think as a mentor, it's not just about teaching a procedure. Now, when I work with colleagues, the first thing I talk about is mindset and the belief and where is it that they want to go. So it's almost a sort of hour, 2 hour long discussion. Where are you? Where do you want to go? How can we get you there? What environment do you work on? Because I can't mentor everybody, and sometimes they're not the right person to mentor for me anyway. And so it's having that background about a mentee and really getting to know them as a person, know their environment, and understand their goals. And then when these things are aligned, then you can start to build on a mentee-mentor relationship. And in essence, it has to be a contract. It has to be a contract where you will then review progress at set times, 6 months, 12 months. And it's not a matter of, I speak to clinicians all the time, and they're like, yeah, I want to do this. I was like, okay, where are you working? Where do you want to go? And then they maybe approach me and talk about full arch. I'm like, so what are you doing at the moment? And they're so far away from doing sort of full arch treatment. And are they in the right environment to do full arch? So doing 1 or 2, 3 or 4 full arch cases a year, you're not the person to really. It's not enough, because you'll just get found out. The first 3, 4 that you get mentored might go well, but if you do the next case after sort of 4 or 5 months, it's your skill level isn't there. I know myself. I go on holiday for 2 weeks and then come back and I start placing implants. You're a bit rusty. It's because it's that memory it needs reinforced every day. Every day you want it reinforced. And most of the cases I'm doing now, I'm mentoring clinicians. So I'm actually not doing the work. But earlier on in the week, I had a case to do myself. And I was a bit anxious. I was like, when was the last full arch I did by myself? And it was weeks ago. And it just comes down to that. Yeah, really. I was like, wow, I feel a bit, because I can't remember the last one I did myself. And what gives me confidence in the work I do is I'm able to help clinicians do work, and then generally the case goes well, and I look at it and go, great. And we're all human. We all want reinforcement that what we're doing is right, and it's good, and the outcome is right. So when me as a clinician, I'm able to help other clinicians do a level of work, get the outcome, and then we take the final X-ray, and it looks really, satisfied with the look. It's a great feeling as a clinician, as a mentor, to look at it and go, wow, I have indirectly done this case, but I didn't pick up the scalpel, I didn't place those implants, they did it. But I had a small part to play in that person doing that clinician doing that, and that patient getting the best outcome possible. And so that's what I would say in terms of mentor and mentee. It's such a hot topic, and it's so important. And and to summarize, mentors, multiple people, have made me the clinician I am, and I wouldn't be where I am without them. And I'm a big believer in having the right mentors around you to develop.
And I think that's right. Is a lot of people think, I just need one mentor. That's not right. Is people have got different skill sets. People are better at different things, and there's no harm in having a number of different mentors for different aspects. It's I consider Howie Gluckman from South Africa one of my mentors, because I've done a couple of his courses. If I'm stuck on a case, I can send it over to him and say, Howie, what do you think? The way that he approaches it and the results that he gets is just exquisite. At Evo, I'm fortunate to have Rudy as my mentor. Now, Rudy's been doing full arches all day, every day for the best part of like 5-6 years. The amount of wealth that he can give to me. And when I started at Evo, it was very much to start with, right, watch how I do it. Let me explain how I do it. Because I was doing all-on-4 and full arches externally, but it goes back to what you were saying a few minutes ago. I was doing a handful a year. And it was really stressful. You couldn't sleep the night before thinking, have I planned it properly? Have I got everything in place? And when you get immersed in it, and you start to, and you've got somebody over your shoulder who says to you, right, watch me do it, then I'm going to watch you do it. But if I think that you're doing it wrong, I'm just going to step in, versus I think you're okay, I'll be in the next room if you need me. And then having to call them in quite frequently. And then it goes to, you don't have to call them in very frequently. Then it gets to the point where you can do most of your cases, but I can still sit down with him and say to him, right, what do you think of this case? What could I have done better? Because I constantly want to improve myself. So there is absolutely a case of having multiple mentors in different fields. And I think that's probably a wise way to do things.
Yeah, and you're fortunate, and I suppose it goes back to that point. So you work in an environment where you've got other clinicians that you potentially look up to or inspire you to do better work. And that's what I say to clinicians want to start in implant dentistry. You don't want to, there's some clinicians that are young and they start off in a single-handed practice, and I'm like, that is no way that would be the right environment. You want to be in a big team where you have people that you can look up to and learn from. And it's the same with the implant dentistry. If you're starting off, you want to get involved in a practice where it's just next door. There's a guy doing grafting. He's placing implants on a regular basis. He's doing full arch. He's dealing with complications. He's restoring implants. And so when we do that initial chat, when we're building up that mentee-mentor relationship, that's why I need to know what environment you work in. Because if you're single-handed, working in the north of Scotland, isolated, then it's challenging. It is challenging.
Yeah. And you've touched on this a couple of times. You're very much keen on understanding the goals of the people who want you as a mentor. And I think having the goal of, well, you know what, such and such person does a lot of implants, they charge this much, it must be really profitable. I don't think that's a good goal to have. I think a lot of people mistakenly get into implants thinking that it's quick money.
It's not.
No. There's a huge learning curve.
Massive. I've been doing implants now 8 years, maybe 9. And it's just like, one day it just clicks and it just becomes so natural to you to place implants, but it takes years to get there. And it's a nice place, and people like to call it flow. So you're really in a state of flow when you're doing this work, and it's a lovely feeling when everything just flows. But it takes years, and it's not a quick buck. It is financially rewarding, but that can't be your focus. Just like anything we do, we're health professionals. We are doing the work we do for it should ultimately be patient care. We are doing work, and it should be driven by patient care. Money is a side effect of everything. Simple.
Yeah, and I think another mistake people make is they look at people thinking, oh well, they're traveling from practice to practice, doing big implant cases. Traveling from practice to practice, firstly, brings its own headaches because even if there's something simple like a healing abutment that's loose, they want you to come back, and if it's 200 miles away, you have to go. And I think the other issue, the other mistake that people make is, and you alluded to this earlier as well, people think you build that up like that. You said earlier when you started, it took you years to build up a network that you could then springboard from. Getting to a point where you're working in multiple practices just placing implants, because I've been stung by this. Yes, Pav, can you start at our practice? We're really busy. You go there, you have one busy month because they've got a backlog of patients waiting to be seen. Then all of a sudden you're going there's no patients, and you're sat there twiddling your thumbs, wasting your time.
So we've all been there, and it's that sort of process of finding places that you want to work. What I would say about being peripatetic, I had to do it. I was based in Scotland. The work just isn't there, and there's a lot, better clinicians than me based up in Scotland. They had the referral practices and they were doing the work. For me to upskill and get better and increase my numbers, I had to travel. And initially, back sort of about 4 years ago, I took a job up in Yorkshire and I'd come down every 2 weeks. And quite quickly, I realised for me to get where I wanted to achieve my goals and fulfil my ambitions, I had to travel. I had to be peripatetic. And it has its challenges. But like anything, it also, working in different practices with different teams all the time makes you better. And it's again, I don't see it, it's a challenge, but it's also an opportunity to be better. And so that's what I would say, working with different teams, different practices makes you adapt. And when you're able to adapt like that, you become better. Also, working with different implant systems makes you better. One of the big jumps I made in my career is switching systems, and working with multiple systems makes you a better implant dentist and not just sticking to one system. I don't believe one system fits all. I use multiple different implant systems, and it's these little things. As a mentor, this is what I talk about. I talk about things that in my career that I look back on now, and as I've deconstructed, what were the little things or tweaks that I made or the challenges, obstacles that I came across that made me better. And at that time, I didn't see it as becoming better. I saw that's a pain, that's a real difficulty. You know, being away from family for 2 or 3 days at a time.
Yeah.
I've been away for 3 days now, and I'm going home up to Glasgow after this. All these things, they make you better, and that's the way you've got to see it. And it's back to that sort of growth mindset. You've just got to put in the work, and you just got to go where you've got to go. And that's what I'm doing at the moment. And for anybody coming in, you will not. It'll be very hard to really upskill with an implant dentistry, just being in one practice, a small practice, 2 to 3 surgeries, expecting to really upskill. You just won't get the numbers. It's as simple as that.
Yeah, I think for people who want to get into implants but don't want to go practice to practice, is for them, kind of doing the simple basics, single implants, that absolutely they can build up that skill set quite quickly, and then they can refer out the complex, quadrants, sextants, grafting and sinus procedures and things along those lines. And in fact, I would probably say is the single implant is probably the most profitable per hour, because like now if I've got a healed upper 6 site, it's a 5-minute job, but it's taken me like 12 years to get to the point where I can do it in 5 minutes. And it's when I was first placing implants in a healed ridge, I'd book out 3 hours, and then I'd slowly get it down to 2.5 hours, then 2 hours, and then all of a sudden that implant wouldn't take, and you've got an angry patient, and you've got to redo it at your own cost. So there is a learning curve that goes with this, and I agree with you. I think if you want to really progress in your career, you do need exposure to it in multiple different practices. If you wanted to add a little bit to your bottom line, absolutely start off and stick to the simpler ones and get somebody else in to do the more complex stuff, because that will actually probably be more profitable for you.
And what I would say in terms of starting off and getting into implant dentistry, there's something that every clinician who wants to start their journey in implant dentistry can do right now, and that's upskill and start doing more surgical dentistry. Yeah. The foundation to implant dentistry is sound oral surgery skills, and there is nothing stopping you doing that immediately. Get the kit, get the setup ready, the right kit, not sort of random bits in bags in different rooms. Get the right surgical kit, get a surgical motor, get a surgical aspirator, get yourself some loops, get magnification, get a light, and start taking out teeth surgically and upskill, because that is the foundation. And that's why my progression into implant dentistry was smooth, because I was sound surgically, because that's all I did. Oral surgery, maxillofacial surgery, that's all I knew. I did that for 10 plus years before I went into implant dentistry. And it was an easy transition. And my progression through implant dentistry has been pretty fast, because the foundation has been solid. And so that's what I say to anybody wanting to start off. Just start with the basics, the foundations of implant dentistry, which is sound surgical skills and surgical management of the patient. And nothing's stopping you doing that tomorrow.
Yeah, I mean, you can even get little boards where it's got like a sample soft tissue that you can practice suturing skills on at home. That's how I used to practice suturing skills. I went to my local butcher. I got pigs' heads and sheep's heads, and I was practicing surgical skills on them. And I was like, you know what, they're not going to complain. And I did exactly what you were saying. As I mentioned, is to start with, I was very uncomfortable with surgery, and I was like, right, I'm just gonna start surgically taking teeth out, and slowly confidence starts to build. And as you do courses and as you do cadaver workshops, as you learn more, your confidence starts to skyrocket. And then it really pushes to another level when you have a mentor, because the mentors will teach you the little tips and tricks which will take months, if not years, off your learning curve. And sometimes it's as simple as, you know what, don't use that instrument, use this one. Push that instrument like this, not like this. this is what you're looking for. You're pushing in the wrong position. Or, you know, if you're drilling like this, use this protocol because that's going to increase your success rate. For me, that's what mentors are. As you quite rightly said, they teach you what they've learned so you don't make the mistakes and so your learning curve is faster than what theirs is. That's what a good mentor for me does.
Yep. They hold your hand and help you go further faster.
So, Ferhan, it's I think we've covered quite a decent amount here. Is there anything else that you wanted to cover?
And so around sort of implant dentistry, getting started, the best time's today. Actually, the best time is probably a year or 2 years for a lot of people, but the next best time is tomorrow. And don't think that you need the patience. You just need the intention and focused intention, and set yourself goals and then work every day. And it's not about working hard every day. It's slow and steady, building skill, building a network, having people you look up to, and then over time having the right mentors around you and the people to support you. And don't let anybody tell you can't do it, because if I can do it, you can do it. It's not difficult. It just takes time. It takes effort. It takes investment. But we'll all get there. And we're all on a path. And don't worry about what other people are doing. Just stay on your own path and stay focused on your path and where you want to go. And that's the most important thing, because we're often distracted by social media, what other people are doing. Don't. Just be focused on your own path. We're all on different journeys. And if you just work every day, a little bit at a time, you'll progress.
I think a dangerous thing about social media is the dentist will only put the 5% of their perfect cases up. They won't show the 80% of average cases, and they're certainly not going to show you the 10% of failures. You know, there's very few people who are willing to show their failures, and those are the best people to learn from.
Yeah, we all have complications. We all have. If you do enough implants, we encounter failures. I have implant failures. I have challenging cases that don't go well. But again, back to having a growth mindset, there are opportunities to improve. What did I do wrong in this case? Was it me? Was it the patient? Or was it something else? And how can I avoid this the next time? But yeah, absolutely. We've all got failures, challenges, difficult cases. And it's inevitable.
Yeah, so I think the take-home message is for anybody who wants to get into implants or anybody who is in implants and wants to progress, you need the correct mindset, you need the intention, you need to invest the money into equipment and education, you need a really good mentor or mentors, and you also need to be exposed to enough of it, because if you're doing 2 implants per year, you're not going to gain the skills to be able to do it. If you are exposed to it every single day, every single week, then yes, you can start to build up your skill set pretty quickly. And people can stop at whatever level they want. If they're comfortable just doing singles, fine, just do singles. Send the rest out to other people.
Yeah, agreed. So yeah, mindset, confidence, self-belief. You've got to believe in yourself. If you're not going to believe in yourself, nobody will. You've got to believe that you're capable of doing that level of work. You might not be capable today, but you've got to believe that you will get there. So work on your mindset, have the confidence in yourself and your ability. Don't be overconfident, but have confidence in yourself that you can develop the skill and have that self-belief. And then start, and remember, foundations, stepwise progression. I think one of the things that people sort of overlook, that one of the real skills of an experienced clinician is what case to treat and what not to treat.
Yes. Yeah.
That is one of the key skills. And as you get more experienced, you're really skilled at not treating particular patients and particular, sort of anatomical variants or particular challenges, may that be clinical or psychological with a patient. That's a real skill as a clinician. Yeah. We're always on a path to learn and to get better at that, because we continuously make mistakes. You think, I shouldn't have done that. I shouldn't have done that. Yeah.
Reflection is a very powerful tool, isn't it? So
Yeah, really important.
yeah. So, Ferhan, you've got a blog, haven't you, on your website, which is ferhanahmed.com, I believe?
Yeah. So, drferhanahmed.com. I have a blog. I just like to write random thoughts, very much based around mindset and some clinical, but mostly sort of mindset and personal development. Also, I have a couple of online implant programs that brings you into my sort of mentoring program, and that's where I can be found. And then I'm on Instagram, YouTube, and Facebook, and LinkedIn.
Yeah. Yes, the critical ones. Yeah.
Yeah.
Brilliant. Yeah. So if anybody's interested in following Ferhan or reaching out to him, those were his details. I mean, for me today, you've solidified what I believe myself is the correct, well, there is no correct way to get into implants, but the mindset that you need getting into it. For example, now I'm starting my journey into being trained for zygomatic implants. And at the moment I just spend every spare minute reading about zygos. I read papers, I've read Apariccio's book, I've done Apariccio's course, I've done cadaver courses. I'm preparing myself so that when I start the practical, I've assisted with quite a few cases, about 50 cases. I've done 3 or 4 cases under the guidance of somebody. I've done a couple myself as well. But I'm now kind of like at the point where I'm ready to really springboard. And I have that mindset, as you mentioned a few minutes ago, that, you know what, for me, there is nothing that's going to stop me learning this and becoming proficient at it, purely and simply because it's a natural progression of my career. It's something that I want to learn to do. I'm prepared to put in the time. I'm prepared to put in the money towards education, and I'm prepared to put in the money towards equipment as well. And that is just what I want to do at the moment. So it's reassuring to me to hear that I've got the right mindset for this. So thank you very much for that.
No, my pleasure. Thanks, Pav. I really appreciate this chat. It's been great.
Yeah, Ferhan, you've been great. I'll hopefully speak to you soon, and I'll let you know once this episode's up as well. So awesome. Thanks everybody for listening, and I hope you've learned something. I'll speak to you soon.
Everybody, take care. Stay safe.
Thanks, mate. Take care. Bye bye.